Welcome back to Studio 701. It's more important than ever to work on our overall health.
It really is. In today's well-being, we welcome our guest, Dr. Elizabeth Jones from Jones Physical Therapy. Hi, Liz. Thanks for joining us.
Yeah, thanks for having me.
So the topic for today is a little uncomfortable to talk about, but you seem so passionate about helping people live a more comfortable life, which I think is really great. So what do you like most about working in physical therapy? We just wanted to know that right out of the gate.
Well, essentially, we treat the entire body. You know, you can do more basic musculoskeletal things such as shoulders and hips and knees, post-surgical, athletes, some work in geriatrics. What I absolutely love about the clinic at Jones PT is we treat some very not well-known issues, some issues that are a little more uncomfortable but deeply impact people's everyday living. We treat the pelvic pain, hemorrhoids, issues that sometimes are a little bit more uncomfortable to speak about, but many people suffer with.
Yeah, and one of those being hemorrhoids. So what are hemorrhoids? Can you just kind of explain them to us?
Yeah, so I was trying to think of a good description, and essentially I think they are something that most people deal with throughout their life at one point or another, and it's an issue no one wants to talk about. They are a rectal ailment, so a hemorrhoid is something where it's essentially most people don't notice it until they see something. If you think of this as being the colon and this being what we see on the outside, so most people don't notice they have a hemorrhoid unless if they get a bulging on the outside here. It can be very painful, itching, irritated, bleeding. What they don't realize is that the actual issue is the internal one. So if you think about this being the colon, what we see on the outside, literally about this far in, we don't have sensation anymore. So here and above is where that internal hemorrhoid forms. So essentially it's like a varicose vein in the canal, and every time you bear down or have pressure, that's gonna bulge out. What people will notice is when that laxity occurs and then there's some tissue loosening on the outside, and when that fills with pressure, it's a very highly sensitive area, so they'll have a lot of pain there. Worst case scenario, they'll get a thrombose, which then it's usually pretty painful for a couple weeks. A lot of people don't realize they have these. They come in for hemorrhoids because of this little irritation on the outside, and we go through common symptoms such as itching, irritation, bleeding, pain in the tailbone, feeling like with their bowel movements they're not emptying all the way or don't empty completely, having to wipe over and over and over and feeling like they can't get clean, and even fluctuation in their bowel movements. Do they have harder bowel movements where they're straining, to kind of weird, greasy, squiggly bowel movements, to, oh my gosh, I gotta go right now? Those are all common symptoms of hemorrhoids that people don't realize.
What really causes them then?
Yeah, so this is what I tell my patients. I feel like there's three areas. There's our digestive system. Are you eating something that's inflaming you? Are you prone to constipation? What's going on there from that health standpoint? And then that area we talked about of the colon, is that tissue do you just have weakness there? Are you genetically prone to weakness there? Does your family have a history of hemorrhoids or varicosities? And then also, the pelvic floor, which we've talked about a couple weeks ago, if that pelvic floor is too rigid, every time you go to have a bowel movement, you're gonna have to bear down a little bit harder to get through that muscle tension. That's gonna put more pressure on the colon there and make those hemorrhoids flare even more.
Sounds very uncomfortable, so obviously we'd like to know about the treatment. So how can you treat the internal ones?
Yeah, so it's interesting because many people, again, are embarrassed by this, even though it's extremely common, and so then they actually don't go in for treatment because no one wants to go into the doctor and say, hey, I've got pain back there, or I'm itching, I'm irritating, I can't wipe clean. No one wants to go admit that. So they tend to, most patients don't get somewhere unless it's really bad. They're having a lot of bleeding or a lot of pain. And then what's commonly given first is topical salves and suppositories to settle down inflammation. Now that might help in the moment, but remember the issue is internally up here, that weakened tissue that's thinned out and bulging. So you can get banding from the physicians. You can have a hemorrhoidectomy, which is actually a surgery. The procedure I perform is done right in the clinic there. You walk in, you walk out. It's actually electric current, which sounds scary, but you don't feel it because we have no sensation up there. But it actually causes that vein to collapse on itself. So essentially, a hemorrhoid's not gonna go away unless we actually fix that weakness in the tissue up above. They may go away for a bit, but they're gonna flare up again when you have a period of stress or pressure or digestive issues. So essentially, we gotta get to the root of it. We have to get up to those internal guys to truly take care of the problem.
And physical therapy, how can that kind of tie into helping out with this issue?
It's a great question because most people get referred and then they say, oh my goodness, what are you going to do for me? Again, I as a physical therapist specialize in treating the internal hemorrhoids, so that is very different. But in general for physical therapy, just wellness, getting good hydration, good diet, making sure you're moving because that helps your digestive tract in general, and then those pelvic floor muscles, making sure they're functioning properly.
Well, thank you so much, Liz. This has been very informational, and hopefully, we reach some people who are watching who might be too embarrassed to go ask, but now they have some more information on it. We really appreciate your time today.
Yes, thank you for having me.
All right, this has been Wellbeing, and for more information, again, go visit jonespt.com. And keep it here. We have our Smile of the Day coming up.
Oh, yes, we always love that. And find out